Hello, my name is Nicholas Look, and this is my Global Health Project for Nursing 495, Public and Global Health in Nursing for Professor Shannon Campbell. Today I'll be discussing the HIV epidemic in Russia, a global health crisis. Let's begin by recognizing that Russia is facing one of the fastest growing HIV epidemics in the world, especially within the World Health Organization European region. Over 1.1 million people in the country are currently living with HIV. What's particularly concerning is that the most affected group includes people between the ages of 15 and 49, right in their prime working years. The primary ways HIV is spreading in Russia are through heterosexual contact and injection drug use. But the real challenge? Social stigma, misinformation, and gaps in prevention programs are seriously undermining efforts to stop the spread. In today's presentation, we'll explore the history of the epidemic in Russia, its societal impact, the barriers to care, and what global organizations are doing to help. Epidemiologically speaking, Russia is a true global outlier. In 2021, it reported the highest rate of newly diagnosed HIV cases in all of Europe. Today, about 0.8% of the Russian population is living with HIV, and that jumps to around 1.5% when we focus on people aged 15 to 49. What's important to understand is how the nature of that epidemic has changed over time. It started in the 1990s mostly among people who injected drugs, but now heterosexual transmission is the dominant route. That said, injection drug use still plays a major role, especially among younger men. So what we're seeing now is no longer a localized issue. This has become a nationwide crisis that affects a broad range of communities. If we apply the epidemiologic triangle here, the agent is the HIV-1 virus. The hosts are individuals in high-risk categories like people who inject drugs and those who are sexually active in the 15 to 49 age group. And the environment includes factors like stigma, political barriers, and an under-resourced healthcare system. Unlike many countries where HIV rates have been declining, Russia's numbers continue to rise. That contrast points to an urgent need for stronger, more inclusive policies and public health strategies. HIV isn't just a virus, it has a deep and lasting effects on individuals and communities. Most HIV related deaths in Russia are happening among adults who are still in their most productive years. These are people who would otherwise be working, raising families, and contributing to society. One of the biggest problems is late diagnosis. Many people don't even know they have HIV until the disease is advanced, which limits the effectiveness of treatment and increases the risk of spreading it to others. Mental health issues are also common among people living with HIV, partly due to the emotional toll of stigma and isolation. Another issue is co-infection with hepatitis C, especially among people who inject drugs. This makes treatment more complicated and costly. Unfortunately, access to antiretroviral therapy, or ART, is still uneven, which means a lot of people aren't getting the care they need. When we look at the HIV epidemic in Russia, it is important to understand that the impact goes far beyond individual health. One of the most affected groups is working age adults. These are people who would normally be contributing to the workforce, supporting families, and participating in their communities. When HIV affects this age group, it lowers productivity and reduces overall labor force participation. Financial strain is another serious concern. In many parts of the country, particularly in rural or low-income areas, people are forced to pay out of pocket for much of their health care. This often creates long-term economic hardship for individuals and their families. Stigma and discrimination continue to prevent people from seeking care. Fear of judgment or mistreatment can be more powerful than the disease itself. In areas with fewer resources, healthcare services are limited or inconsistent, which makes things even harder. On top of all that, public health education about HIV is still lacking, which allows misinformation and fear to persist. Despite the availability of effective treatments and prevention tools, many people in Russia still face significant obstacles when trying to access HIV care. One major issue is that ART is not evenly distributed across the country. Urban centers tend to have more consistent access, but rural areas are often left behind. This results in delays in treatment and poor outcomes for people in those communities. Another missed opportunity is pre exposure prophylaxis, or PrEP. This is a powerful tool for preventing HIV, especially in high risk populations, but is underused in Russia due to limited funding and public awareness. Meanwhile, key populations, like people who inject drugs, often avoid care entirely, not because services don't exist, but because they fear discrimination or even legal consequences. There are several evidence-based strategies that can help bring Russia's HIV epidemic under control. One of the most important is universal access to art. When people living with HIV receive treatment early and stay on it consistently, they are healthier and much less likely to transmit the virus. Another key approach is the 95-95-95 model, which sets 3 global targets. The goal is for 95% of people with HIV to know their status, 95% of those diagnosed to receive treatment, and 95% of those on treatment to achieve viral suppression. Those benchmarks serve as a roadmap for countries working to end the epidemic. PrEP is another powerful prevention tool, but it remains underused in Russia. Peer-led outreach programs can increase engagement and trust. Monitoring for drug resistance helps tailor treatment more effectively. Finally, combining HIV services with mental health support leads to better adherence and overall outcomes for patients. One of the biggest challenges in controlling HIV in Russia is a cultural and institutional stigma that surrounds the disease. Many people are still afraid to talk about HIV, and that fear keeps them from seeking testing or treatment. Silence and misinformation create a dangerous environment where myths thrive and prevention is difficult. Sex education is also extremely limited. In many places, it is either restricted by law or simply not offered at all. Without accurate information, people cannot protect themselves effectively. Certain groups face even greater obstacles. People who inject drugs and men who have sex with men often experience direct discrimination, both in society and in healthcare settings. Many avoid medical care because they fear being judged, mistreated, or criminalized. This stigma does not stop at the community level. It is also present in clinics and hospitals. Some providers hold personal biases that make the vulnerable patients feel unsafe or unwelcome. To truly reduce HIV in Russia, the country must address these deep-rooted cultural barriers. When it comes to tackling HIV on a global scale, international cooperation plays a vital role. Organizations like the World Health Organization offer detailed guidelines on HIV testing, treatment protocols, and prevention strategies. These guidelines help shape national responses and ensure care is based on the latest science. In addition to global guidance, international collaboration brings countries together to share research, funding, and practical tools that can improve outcomes. For countries facing resource limitations like Russia, these partnerships can be especially important. Unfortunately, Russia still lags behind global averages when it comes to access to antiretroviral therapy and achieving viral suppression. This gap highlights the importance of support from non-governmental organizations, or NGOs, many of which step in to provide services where public systems fall short. Global health experts consistently advocate for expanding harm reduction programs and making care more inclusive. These steps are essential to closing treatment gaps and reaching vulnerable populations who are often left behind. As we close, it's important to reflect on what we have covered. The HIV epidemic in Russia is not only a medical issue, but a complex public health crisis shaped by cultural, economic, and political challenges. We've seen how transmission patterns have evolved, how certain populations are disproportionately affected, and how gaps in care and stigma continue to fuel the spread of the virus. But we've also looked at real solutions, evidence-based strategies, peer-led interventions, better mental health integration, and international support through organizations like the WHO and UNAIDS all offer a path forward. What's needed now is stronger commitment and political will to apply these tools at scale. The references on the slide represent the research and data that informed today's presentation. Thank you for your attention and engagement. I welcome any questions or discussions as we continue to think about how to turn knowledge into a meaningful action. Thank you.